to Conspiracies Against Wellness with your host, Janelle Elderley.
Good evening, and welcome to Conspiracies Against Wellness. I'm your host, Janelle Elderley. Tonight, Dr. Mark Isben is joining us again to give us an update on what happened professionally with the Montana State Medical Board and all alternative treatments he provides and how well they work for his patients. If you have questions for Dr. Isben, please call in at 415-915-2299. You can also listen and chat live with our audience from our YouTube channel, Conspiracies Against Wellness live stream. And now I'd like to welcome Dr. Mark Isben to Call Nation. How are you this evening?
I'm great, Janelle. Great to talk to you.
Well, it's so good to have you back on. So a lot has happened since you were last on the show in May. Would you please like to share originally what occurred with the Montana Medical State Board?
Yeah. So about 5 years ago, I started seeing patients who I call opiate refugees coming to my urgent care, having been cut off of their pain medications. And I decided consciously to help some of those people off their opiates, and was quite successful with about 80% of my patients. This seemed to disturb the powers that be. And I think it was the opiate thing and the cannabis thing, because I was helping people off opiates using cannabis. So lots of success, but a little bit of a threat to the status quo. So they initiated a threat to my license. We had about a 5-year battle. They suspended my license in March of 2016. That was immediately reversed by the court judge, and a temporary restraining order was issued. And lo and behold, right after our last meeting, this was in June 27th, I guess, the district court judge finally gave a ruling, and he ruled in my favor permanently. So I consider it a victory, and I now I'm feeling free. I might not be as free as it feels. The judge actually sent the case back to the Board of Medicine and told them to do it right if they do it again. So I don't know, and I haven't heard from the board whether they're going to retry the whole thing or let it go.
Okay, so what happened most recently, though, with it? I mean, did they...
Yeah, I won my case.
Okay.
I won my case, but
what did you win?
Not a complete victory. It was a district court ruling by Judge James Reynolds, and he said that the Board of Medicine should have listened to the hearing officer that they hired to run the case, who ruled in my favor originally. The Board of Medicine ultimately ignored that ruling and took an action against my license to suspend my license. The judge basically pointed out that they violated my due process rights and should never have gone this far. So he really spanked them hard. So we'll see what happens now.
Has this happened to other doctors?
Not quite in this way, and I'm thinking of myself as one of the lucky ones. Most doctors who've been in trouble with their board, the boards of medicine kind of operate in a sort of a medieval way. They operate like the beatings will continue till morale improves. So they're very, very punitive with doctors, and doctors don't like to be punished. And we're used to getting A's and being pre-med and all that stuff. We're not used to being sent to the principal that often. So it's a kind of a punitive thing, and most doctors cave. This was so egregiously unfair to me that I didn't cave, and I stood up to them, which really upset them. And then they really made my life miserable for about 5 years.
How so? How did they do that?
We had 9 hearings. They brought in a some expert witnesses that lied about my case. The attorney for the Board of Medicine essentially lied about the numbers in the case. I basically presented evidence that all of my patients were weaned. In fact, of 9 patients in the case, 7 of them were off the opiates at the time of the hearing. So I was so successful, I thought they were going to give me a trophy, but they managed to kind of gum things up, and I think they just wanted to use me as a scapegoat, and I just didn't really want to go along with that.
Yeah. Did you lose your license to actually be able to prescribe pain medication, or what?
For about 36 hours, my license was suspended until my appeal went through.
Okay.
So yeah, that was a temporary thing. I now have the right to prescribe opiates, but Montana is such a wasteland for pain management, and it's such a hostile regulatory environment that I have decided that it's not really safe for me to prescribe any opiates to anybody. And I haven't been doing so since Dr. Christensen was convicted back in November of last year.
Yeah. Now, why is Montana like this? I mean, are there any other states that are similar?
Well, why was Afghanistan the way it was when the Taliban were in charge?
Right.
You know, I think it has to do with. I mean, I'm sure there's some politics and belief in the whole thing. But the other thing that's really important is that Montana already has one of the highest rates of suicide in the nation. We have dark winters and long cold winters. We have a lot of hardworking people who get injured, similar to West Virginia. There's mining here. There's timber industry. So these are hardworking jobs and hardworking people who often get injured, then get surgery, then end up in chronic pain. And the other thing that's happening in Montana is epidural steroid injections are a very popular item here, and a lot of people receive many steroid injections. And I don't know if you or the folks listening are aware of this, but there's a rare side effect called adhesive arachnoiditis, and yet it's epidemic in Montana because so many of these procedures are done. There's only 1 million people in the state, but there's thousands of these procedures going on, and a lot of people in chronic pain. And once you get adhesive arachnoiditis, you're screwed.
Yeah. Now, these injections, they're not FDA approved, are they?
Correct. Isn't that just shocking?
It is.
Every time I meet somebody and tell them this, that insurance companies are requiring epidural steroid injections prior to a person getting surgery, it's become the standard, and yet it's never been proven to work. I mean, only 50% of lumbar spine injections improve people, and less than that in the neck. So these are iffy procedures, and they got accepted as a mainstream treatment, and I don't know how that happened.
Well, and with all of with people getting like arachnoiditis and permanent damage for life, why aren't they taking it off the market?
2 words: ka-ching.
Yep. Okay.
It's these guys are getting reimbursed, $2,500 an injection, and essentially people, people are desperate, and they want to have hope, and their doctor says, well, we're going to try this, and maybe we hope it'll help you, and people feel betrayed when they find out that they've been given an additional illness to their degenerative disc disease by receiving these shots.
Now,
the ironic thing about this, Janelle, just a quick note, is that people who have degenerative disc disease are generally youthful. I mean, 20s, 30s, 40s. As you age, this idea about degenerating disc, people get the idea that, well, my spine is turning to dust, and if I don't have this done, then I'm not going to be able to walk, or I'll be in a wheelchair. It turns out that as you age, your discs actually shrivel, and they don't press on the nerves so much. So if people can just get through these periods of difficulty with sciatica and back pain in other alternative ways without having 30 of these back injections, then they can age out of that young person's disease called swollen herniated discs.
Well, and also, if you get more than like 3 within the same area, doesn't that start breaking down your soft cell muscle tissue?
I'm not sure about that breakdown, but there's several things. Of course, there is a steroid involved. And the interesting thing that in order to make a steroid long-acting, they bond it to a crystal. So it's absorbed slowly. And that's the problem, is in some people, the crystal doesn't dissolve. It just sits there in the spinal area, in the subarachnoid space, and it causes an irritation. It irritates the arachnoid layer of the spinal layers. That becomes sticky because it's inflamed, and that's where the adhesive arachnoiditis term comes from. It sticks to the dura, and spinal fluid doesn't flow. And instead of having a temporary problem, you now have a permanent one.
Is there any research, or do you know, when you're getting these injections, about how long or what happens? How do you know when, something else is wrong, like really wrong, permanently wrong?
Well, they do an MRI on a patient in order to determine if they're a candidate for an epidural steroid injection or surgery or any other interventions. So they think they're doing the right thing. Unfortunately, you bring up a great point, because it's very difficult to make this diagnosis, because people don't get the diagnosis until they've had many injections, and it's hard to find out which injection was the one that caused the problem. Therefore, and if you can't find out what the cause of it is, then you can't, you can't sue for it. You can't find a malpractice case for it, because it takes years for adhesive arachnoiditis to present itself. And 30 years ago, I had a steroid injection. I mean, I had one, and it worked. They used to be done like maybe one, maybe a second one in your life, but nowadays people are getting 4 a year. I've talked to people who've had 50 of these.
Wow. Okay, so now, what treatments options do you now provide to your patients?
I am now just a country cannabis doctor. I get to drive around the state of Montana. I've got the best commute in the world. I go to Helena, Butte, Great Falls, Havre, Kalispell, Missoula, and I participate in cannabis clinics, and 20, 30, 40 people will come in, and they'll bring their records, and I'll review their records and see if they're a candidate to be benefited by cannabis. That's my majority thing. I have one other thing I'm starting up, and that is in Missoula, which is about 100 miles from here. I've just started doing a ketamine clinic, and people are asking for ketamine injections. I'm not that familiar with it yet myself, so I'm starting very slow, so I'm not really promoting this much, because I want to get used to this tool myself. But apparently ketamine can take people to a dissociated state and somewhat reboot their brain into reinterpreting their pain. So a lot of chronic pain patients are swearing by it.
They also use it for the disease CRPS. Have you seen any changes, or have you had what kind of feedback have you gotten from your patients so far on it?
I think I've had 4 patients receive this infusion, and they've all had various degrees of benefit. One fellow said it didn't really help him much, but when I talked to him, his voice was more animated. It seemed like his mood was a little bit better, and he probably needs some follow-up, and he's not willing to do that. Another couple of people have had the injections and said, I haven't been this pain-free in 10 years.
Really?
So that's pretty encouraging.
Well, that's wonderful. How have you seen the medical marijuana? How does that work for your patients?
So about 80% of my pain patients have been able to get off all of their opiates with medical marijuana. The other patient population I run into, of course, people with autoimmune illnesses like MS or Crohn's disease or psoriatic arthritis. And my cannabis patients sometimes tell me, well, I don't get much pain relief, but it feels like my pain is over there in the corner instead of right over my face, like an alien sitting on you. So I think it helps people's well-being in ways that we don't really understand that well. And frankly, people who've had chronic pain, at least in my state, they don't have any other choices. So they feel betrayed. They feel abandoned. They feel like they've invested multiple surgeries and lots of time in their health, and they've been, and they're not any better.
Yeah.
And so, of course, I don't see the patients that don't come back. Some people give up on cannabis, I suppose, but I've seen people for 5 or 6 years in a row getting their cannabis card, and I ask them about their miracle, and they describe it for me. I have seizure patients that had breakthrough seizures, couldn't get them under control. Their seizures are better controlled, like that. And for PTSD, it's amazing. So most of my pain patients have a certain degree of PTSD. So it gives them a certain amount of detachment. It helps sleep. Sleep's the foundation of well-being. It helps appetite in people who can't eat. It helps people with neuropathy. I see a lot of diabetics and people in chronic pain who are on gabapentin or Lyrica, and those patients, I ask them, "Are you on Lyrica?" "Yeah." "How's your memory?" "Oh, it's not so good." "Do you think it's the Lyrica?" And I go, yeah, it is. And 100% of my Lyrica and gabapentin patients have been able to get off that with cannabis. So I don't give people advice on coming off medicines. I just say that, if you want to take the risk of brain fog, weight gain, depression, suicide, and memory loss, continue to take your gabapentin. Otherwise, use more cannabis. People smile when I say that, but it actually works for them. So we've got a lot of happy patients.
We have a question from YouTube. Can extreme pain cause a type of PTSD?
Yeah, absolutely. I've got a promise here to watch my language. So pain is a friggin' terrorist.
Yeah.
and people who have been terrorized, they don't sleep. They're having pain. So those are the two legs of the stool of torture, right? So people are feeling tortured. They're not getting good pain relief. They think no one cares about them. And pain, in addition to just causing that misery, pain causes us to isolate. As mammals, we're sort of designed to go in a corner and lick our wounds till we're better. And isolation is a bad thing for people in pain, because you begin to think that you're the only one who has it. You have the most severe pain in the world, and it is to you. And so it's very traumatic to people. It violates people's boundaries, just like a rape or a bully or a bomb exploding in Iraq. Pain like that is a bomb going off in people's lives. I mean, people get CRPS from just from an injury or a procedure, and all of a sudden your arm feels like it's going to explode, and all you had was this seemingly minor injury, and you're wondering, why did this happen to me? And it's rampant in the pain population.
Yeah. We have a caller from area code 502. What is your name and what's your question?
My name is Steve, and you were talking earlier about ESIs, and I think you may have not made it entirely clear. The drug that's used normally is methylprednisolone, and it is FDA and Upjohn, the company who discovered the drug, do not recommend that drug to be administered in the spinal cord, in the ESI. The drug itself is good for other purposes. It's just in that particular application, they don't recommend it.
Thank you, Pharmacist Steve, for clarifying that.
You recognize my voice, Mark.
You can always count on Steve to keep us on the straight and narrow. I appreciate that.
Well, it wasn't a straight and narrow. It was just finishing the sentence.
Yeah. No, you're right. You're absolutely right.
How are you doing, Steve?
Yeah.
I'm still old and haven't been able to find a cure for that either.
Yep, we all get old.
More cannabis for you, buddy.
Well, I'm in Florida, so it's legal down here right now.
Yeah.
Yeah, it's illegal in North Carolina, too.
Yeah, so when we head for our daughters, I can get it, and I can get it down here, but we're heading back to Indiana next week. So up there with the Bible thumping people, it will be hell will freeze over first before they. But I take that back. I think there's a proposed bill in Indiana for some sort of marijuana legalization in this upcoming session. I think I read that someplace.
Mm-hmm.
But,
wow, hell just froze over.
Pretty much. But the thing in Indiana, we have a long session and a short session. We're in a biennium, and the long session is when things actually get done. And this session that starts in January is the long session. So if any chance of it getting passed, it will be in a long session. So, I'll let you get back to talking about your weed business.
All right. Thank you, Pharmacist Steve, for calling in.
Take care. Bye-bye.
Bye-bye. Love that guy.
Yeah, he's great.
He's helped so many people.
Mm-hmm. I've seen some of your videos recently of your patients, especially I think there was like an 84-year-old woman that she was taking off pain medications. How are they dealing without pain medicine?
Yeah, I saw these two cute ladies, 178 and 183. And I was in Havre, which is far north of here. It's like an hour short of the Canadian border. And this one lady has rheumatoid arthritis, and her rheumatologist, adventurous guy in his 70s, he fell in an ice climbing accident and died.
Oh, my goodness.
And she was receiving something like 40 oxycodone, 10 milligrams a month. It was just, like one a day or at most two a day.
Yeah.
And since her doctor died, no one will fill her prescriptions, and she's miserable.
I hear that
She
a
didn't
lot.
actually go. She didn't go through withdrawal or anything. She's not even that dependent on it, but she's just having, horrible pain, and she's used to having relief. And once you get used to having relief, not having relief is really torture.
Oh, yeah.
So she and her friend came, and they were there at the same time. And they're so cute. It's like arsenic and old lace. So I'm thinking maybe it's cannabis and old ladies or something. But the other lady was like 83 years old. She'd had a back fusion with hardware. She had a 12-inch scar on her back, and it had been so long ago you could hardly see the scar. It had faded so much.
Oh, wow.
So she's 83. She got operated on maybe 20 years ago. Her doctor will only give her hydrocodone, and it doesn't work for her. Well, her doctor doesn't know that different medications don't work for certain people depending on what the status of their CYP450 enzyme system is. So her doctor doesn't know that, and I told her about it, so she's going to do some research on it. But essentially, her doctor's too intimidated to get her anything stronger than a mild opiate pain reliever, and so she's getting no relief at all. So, they were both perfect candidates for cannabis, and they ended up leaving with a certain amount of hope, and that someone would listen to them, that there's something for them besides suicide or the agony of not being able to get out of bed, and they promised that they'll tell me next year how they're doing. So
great.
Go ahead.
How does somebody, that age, how do they think of medical marijuana? I mean, do they think it's okay to take? Are they afraid?
Well, the average age of people in the Montana program is 47. So some people come in, they say, do I qualify? And if they're born before 1950, I go, you're qualified just on your date of birth. So folks that are in the 60s, 70s, and 80s, they benefit greatly from cannabis because of its low side effect profile. So almost every other medication causes terrible side effects. In other words, the Tylenol affects the liver. The nonsteroidal anti-inflammatories can cause renal failure, or it can cause GI bleeding, or high blood pressure, or heart failure. So when people say just take some ibuprofen, they have no idea what kind of curse they're giving to some patients. In fact, ibuprofen kills almost as many people as Percocet does. I think opiate overdoses are like 16,000 a year. They've inflated all these numbers recently, but
right.
Just from an opiate that you've been prescribed, it's about 16,000 a year, and about 14,000 a year die from a nonsteroidal anti-inflammatory agent. So,
are we going to start
side
seeing
effect profile so low?
Yeah, are we going to start seeing people with issues from side effects from like NSAIDs and Tylenol and whatever?
Well, we already are.
Yeah.
And we're going to stop seeing them because more and more people are getting on cannabis and coming off those toxic medicines. So, what I explain to my elderly patients, some of them are old hippies, but some of them are, never touched cannabis. And the people that never touched cannabis, I say, well, that's good news. You don't have to unlearn anything. The cannabis growers, they're called providers in Montana, just to confuse things. But the cannabis providers in Montana are good at growing cannabis, and they're good at dealing with people and holding their hands about introducing them to something that's foreign to them. Mm-hmm. And what I tell my patients is, a cannabis recommendation is different than a prescription. If I write you a prescription and it doesn't work out for you, you're going to come back and see me. Whereas when you write a cannabis recommendation, you're empowered for the next year to develop your own cannabis program in concert with your cannabis provider, like they're your coach or a teacher. And they're going to teach you how to use cannabis to its best, the best thing for you. And I ask my patients to not give up on cannabis. And so their assignment, and I'm going to almost swear again, is whenever a new patient leaves, I say to them, if you haven't had a miracle, I'm promising, within 2 months, you go back to your provider and say, Dr. Ibsen promised me a miracle. Where's my blankety blank miracle?
Right.
And they get them.
We have another call, a caller from area code 209. What is your name and what's your question?
Hi, this is Ariane.
Hi, Ariane.
And I'm from California. Medical marijuana has been legal here for quite some time, and they just legalized it for recreation.
Yeah.
Yeah, so couple things. When I was injured in 2010, blew out a few discs in my neck. Was put on some opiate therapy, as well as they had me on gabapentin at first and some muscle relaxers. And eventually I started being threatened by my doctor at Kaiser, told that if I didn't have the steroidal injections in my neck or surgery, I would be cut off medication. And I denied the procedures. Having a medical background, I knew the risks involved in both procedures. Anyway, I ended up kind of going my own way once I was presented with a pain contract. I refused to kind of jump through all their hoops. And in the back of my mind, I thought cannabis was going to be a place I could go if I couldn't deal on my own. And what ended up happening was now I don't have anything because cannabis did not work for me. And I tried various strains. I was getting severe anxiety attacks from certain strains, no pain relief, really. And now I'm without anything but NSAIDs, really, at my disposal, which are causing gastric issues, but what else is there for me? And what I noticed is that in the states where marijuana has been legalized, it has the most stringent anti-opioid regulations and attitudes. And what's going to happen if we don't have doctors who are going to stick up for people like me? And I'm not the only one. There may be a lot of people who can resort to cannabis. I'm not one of them. And there's a lot of people like me.
Well, you ask a very, very challenging and difficult question. And the basis of your question of what's going to happen if doctors won't stick up for us is doctors can't stick up for you. I mean, that's basically the truth of it now. They are hunting doctors and arresting them for helping patients in pain. Dr. Tennant in California had his clinic raided, and the person who did the raid had 13 weeks of training. You know, and this is a doctor who's 78 years old, has 45 years of experience in treating pain. In Montana, the standard of care is established by a jury of 12 in a town called Hamilton, where they arrested a doctor who was helping people in pain. He knew that they were some patients who were rapid metabolizers and need higher doses, and until law enforcement and government and regulators get out of the physician-patient relationship and let doctors who are trained help patients in the best way they know how, this is going to continue.
But doctor, being a patient advocate, I'm a pretty strong advocate.
It's hard. It's hard.
Well, the thing is that when patients advocate for themselves, when they go and try to approach government or even our doctors or the AMA, for instance, I've been fighting on all fronts. We are considered not credible sources. So, that being said, it's great for everybody to say we have to stick up for ourselves as patients, but when we're considered not credible, then no one's listening to us. And if doctors on force, because I know about Dr. Tennant, I know about your situation, and it's disgusting what's happening. But if doctors across the board stood up and said, government needs to get out of my exam room, and that's not happening.
No, it's not.
And I'm going to be abandoned. I'm already abandoned. I'm an opioid refugee. I'm out here and with no alternatives now.
I have friends, former patients of mine. First of all, 6 of my patients are dead. That's
right.
Anguishing for me. I have patients growing poppies, figuring out way to use that. I have people in Great Falls that are using poppy seed tea. I've read about wild lettuce, kratom, all these other things. But ultimately, there's going to be people who need to have opiates, and there always have been, forever. And pretending that, like the state of Oregon wants to take Medicaid patients to 0. That's just cruel. And
do you notice though? Do you notice though that, like Oregon, cannabis is kind of prevalent there, and what I see is that the government has a real lax attitude now, or it's becoming more so with the cannabis, and saying, "Hey, all you opioid, poppy heads, just smoke some weed." And that's all great and fine for the people that it helps, and I'm for cannabis for people that it helps.
Yeah.
I don't have any problem with that. Kratom. I think that all options should be available, and actually decriminalizing drugs would be even better. But I'm really concerned about people that are in my situation, who kratom is hard on the adrenal system. And it would not be for me with chronic fatigue syndrome probably a good thing, because I'm already probably on adrenal exhaustion. So,
Me too.
Yeah. So I appreciate, the time, but I'm really worried about, the people like me who really need access to this. And I really don't see, I don't see the forward motion that we're going to need and the masses that we're going to need to make change.
I agree with you. When it's time for marching, call me. I'll go with you.
I'm going to be out in my town on the 18th for the DPP. I'm going to probably be out there by myself in Mariposa. So if you're going to visit Yosemite, stop by on Tuesday the 18th. Anyway, all right, you guys have a good night.
Thank you, Erin, for calling in.
God bless you.
Okay, bye.
Bye-bye. We're going to take Go ahead.
Oh, go ahead.
No, what were you going to go say? Sorry.
I was just going to apologize from a guy in a white coat to the people who've been abandoned, to the opiate refugees. I never thought this could possibly happen.
Yeah.
To my beloved profession. And it's inhumane, it's cruel, and to the person who last called, I apologize if I sounded glib about it. I don't. It is awful. And if we ever get it turned around, we'll save medicine in general, because you cannot do medical practice with a committee of 10 in the exam room with you.
We're going to take a break, and we'll be right back.
This is Claudia Morandi, patient advocate and founder of the National Don't Punish Pain Rally. If you or a loved one are being denied access to pain management, visit don'tpunishpainrally.com. That's don'tpunishpainrally.com. Nobody should have to suffer.
And welcome back to Call Nation with guest Dr. Mark Isben. Dr. Isben, I know it was Arian that called in. I know this has to be hard on doctors as well, and especially yourself. I've seen your posts and I've seen your videos. How are you? How do you deal with it? I mean,
just barely.
Yeah.
I grieve, and I go to my therapist, and I go to my Al-Anon meetings, which is a program for powerlessness. And I didn't go into medicine to be powerless, I'll tell you that. I've been an ER doctor for 35 years. If you need a chest tube, I'll have it in before I can say Jack Benny. But I've never been powerless as a physician before. And there's something about being powerless in a situation that has me looking for solutions. It has me knowing that I've got to take care of myself, knowing that I've got to sue my medical board for what they did to me, and maybe that'll turn some tide. At first, when I read about the institutional medicine report where they said 100 million Americans were in pain and it's a $600 billion impact on the economy, I thought, well, that's going to change things, but that got ignored. That got filed in that same warehouse as the Ark of the Covenant from Raiders of the Lost Ark, and people are ignoring the data because of some emotional, uninformed decisions about doctors who prescribe Percocet to Johnny, the star quarterback who breaks his collarbone, and 7 years later he's died of a heroin overdose, and it was the doctor's fault. It's insane, and we've got to. I've got a new hat I want to invent. Make empathy great again. I think that until we start caring for each other, and really caring for the most suffering among us, we're going to fail as a culture. And this is a reflection of what's happening in our culture in general.
Yeah.
And we've got to pull together, or we'll hang separately. Didn't Nathan Hale say that?
Hale or Mandela? I'm not sure which one.
Yeah.
We're going to take another caller. Caller from area code 980. What is your name and what's your question? Hello, caller from 980.
Hey, can you hear me?
Yes.
It's Jess.
Hi, Jess.
Hey, so my question for Dr. Isben is that, first off, I just want to make a statement and say that it's not your fault, but I want to say thank you for just feeling empathy, because so many of us have not felt empathy. But at the same time, I've seen a lot of patients not feel empathy towards their doctors. And I think we took our doctors for granted for before. But my question to you is this, is that you mentioned that, that feeling of feeling powerless, unable to, do certain things and having to, do things for yourself. We are still here for our doctors as well. What can we do for doctors that are feeling the same way that you do? I'm going to be honest with you. When I found out about my illness, I'm still working over feeling powerless. I've worked since I was 14 and then was made to stop working, not even 2 years ago. So, that to me was really difficult for me, finding purpose. But I want to be able to help you guys too, because I really, truly feel like the only way we're going to turn this around is as a community, as one.
Great question. Thank you. Here's what happened for me, and here's why I survived. I had a loyal group of patients, and I had some friends and staff and affiliates who helped to let my patients know when my hearings were happening. I had 9 of them, and I had over 100 people at each of these hearings standing by me, and that was the headline in the paper. Instead of Dr. Isben, criminal drug pusher, it was Dr. Isben hearing. 150 people showed up. There weren't enough room for people. So if your doctor gets arrested, show up in court. If your doctor loses their license, show up at the medical board. Letters to the editor about how great your doctor is and has helped you. But the DEA came to visit me 5 times, and they were threatening. But in a vague kind of way. They just said, you shouldn't prescribe to patients like these. And I said, patients like what? And they said, well, patients who might sell their pain medicines. And I said, isn't that everybody? What do you want me to do? And then they said, well, we can't tell you. We're not doctors. So it's basically a perfect storm of harm to physicians that are killing themselves, patients that are killing themselves, and this is a complicated issue that requires a complicated approach. And everybody who's published on it has missed something. And just saying that we prescribe too many opiates and it's led to a heroin epidemic is, that's the law of unintended consequences, manifested. There's a phrase I've heard recently that just terrifies me, and that is something must be done. And it's true that families who've I just lost my nephew to a heroin overdose a month ago, and it's horrible, and it's so damn preventable. The country of Portugal loses less than 5 people a year in their decriminalized system. It's not perfect, but there's less addiction rates, there's less crime, and drug use all over is decriminalized, so it becomes a medical issue. If you take illegal drugs, it's hard to come out of the shadows to get help. And so your tendency is to shoot up in a closet and die. But in Portugal, you can inject whatever medicines you need, and they will be there with you, and so prevent you from dying. I think that if we don't want people to die, that's how we're going to have to do it, because it's been a $2 trillion failure with a drug war against patients, essentially. It's a war against people. And addicts and pain patients ought to pull together and not say, oh, see, they're treating the addicts great and they're letting pain patients go by. That's not the case. No one would wish an addiction on anybody. It's a horrible life to live, and some people recover and some people die. And now, we are disassembling a world-class pain management system that was developed over the last 20 years, and we're taking ourselves into a third world state. And that is a political and cultural and law enforcement issue that neither patients nor doctors can necessarily solve, but we can continue to make them aware. And it's happening. There's 5 years ago, I'd be overjoyed just to see a post by pharmacist Steve about something, right? Okay, somebody gets it. But now you're seeing stuff on Huffington Post. There's a great article that Art Levine did. Mm-hmm. You're seeing stuff in other venues, and eventually somebody important is going to have somebody die, and it's going to be important enough to them that they make an issue of it.
Yeah. Jess, did you have any other questions?
No, I just want to say, first of all, I'm sorry for your loss.
Thank you.
I guess I just have another one statement. You're right. But I will say that, for example, I'm meeting with my congressman tomorrow, the one who actually won in the early race. And I've printed up a bunch of documents, but I've actually been putting people in our shoes. Like, how would you feel? Or have you ever, for example, I spoke to a woman who, her husband had a kidney stone. Well, my husband had a kidney stone. How would you feel if they gave you Tylenol? You're in a certain position of power. How would you feel? Knowing you were powerless, you couldn't do anything to help them. And I've just found that it's been really helpful, and I agree with you. They're not going to really stop until they know how it feels. I just wanted to say thank you. And, again, I'm sorry for your nephew, but I agree with you wholeheartedly. Everyone has to come together. And we've got to take a stand, or else we're in trouble.
And it's not just for us. We have to take a stand for all patients and all physicians.
Exactly.
The physician-patient relationship is sacred, and we're contaminating it, and we've got to purify it. Thank you.
Thank you, Jess, for calling in. We had a question. Did you by chance catch the show last night with Dr. Klein?
I did not.
Okay. He was talking about the addiction gene, and like addiction A, B, and C. Have you ever heard of that, or have heard him talk about that?
No, but he's a lot smarter than I am, so
okay.
I defer to him on that.
Yeah, they were just wondering if you agreed with him or not. So,
well, I do have some experience around addiction. I got a family full of it, and here's my take on that. when you test people for their CYP450 system and how they metabolize opiates, you also get some feedback on how people metabolize other things, such as adrenaline or epinephrine. So there are people who rapidly metabolize epinephrine. Those are called adrenaline junkies. They need a next adventure within 4 hours to keep themselves interested in life. Then there's other people who don't metabolize that very well. Those are people who want things really quiet and they don't want a lot of action in their lives. And so I think there's a biochemical answer to most of these issues, and that most of us who are treated in chronic pain have some sort of trauma to deal with, whether it's the PTSD of being abandoned or whether it's something in our childhood that has us respond certain ways, or whether it's a genetic predisposition. I think they all overlap, and it's very, very complicated and convoluted, and it's not a simple, if you had, it certainly isn't along the lines of this Attorney General who says people should just take a Bufferin,
right,
or some other idiotic thing like good people don't smoke marijuana. That's just nuts.
Right. We have a call. I know, exactly. A caller from area code 502. What's your name and what's your question?
This is Steve again.
Oh, hi, Steve.
A couple of things, Mark, that I have the advantage or disadvantage to be able both to be in the middle of the fight and stand back and look at the big larger picture. The DEA has advertised for financial analysts to evaluate pre-seizure evaluations. I get this opinion that the DEA is keeping estimated assets net worth of doctors, and that is one of the criteria to go after 50-plus-year-old doctors who have assets. And one thing those doctors could do before the vultures start circling is create an irrevocable trust, and they basically make themselves penniless, which means there's nothing for the DEA to seize, which makes them less.
Yeah, that already happened for me.
Well, yeah, but if you had done that before they made you penniless, because that's generally what they do. Look at Christensen. It's like the schoolyard bully. They
Dr. Henson, too.
Tie your feet together, rob your pockets, and then kick the crap out of you.
Yeah.
The other thing that I think would work is that if the medical community got together and created a non-profit for a legal defense fund and find a junkyard dog law firm that would take the DEA on. I think, what's that one doctor? Mangino?
Dr. Mangino.
He basically claims he lost because he had tried to defend himself and he had decent law firm represent him, he would have won. And I just think that I mean, I don't know how many hundreds of thousands of physicians there are out there, but they kick up $100 a piece, that would create a pretty substantial legal defense fund. And they could pick and choose who they defend, of course. There are some bad apples out there. You don't want to defend them. But if the DEA walked away licking their wounds a couple of times and doctors didn't have any assets because they created irrevocable trust, they might have to find a new business plan.
Brilliant. I'm for that. If we can only find a few doctors that would stand together. I mean, I've taken my reputation from the top to the bottom in Montana by taking this issue on, and there are doctors who don't speak to me. I think doctors are some of the most fearful people on the planet, and tribal too. So they haven't shown up in droves to thank me. It's been more like Doctor Who.
Yeah, did a lot of people did a lot of people kind of go away from you once you got once you were the medical board was going after you or slapped?
Yeah, I was shunned by my medical society quite fiercely, and the medical society is kind of it's sort of like the AMA. It's run more by specialists, and frankly, this is going to hurt a bit, but the specialists are part of the problem here. They developed this anti-opiate crusade in order to have opiates disappear so that people would have more epidural steroid injections and back surgeries and other procedures. And they've relegated pain to a specialty status now. It used to be everybody treated pain. So now that pain is a specialty status, then that concentrates all the pain patients in one location and under one physician or 5, and then they take them out real easily. They don't have to hunt for them. Yeah. So it's actually it's a perfect way to completely obliterate the medical profession's ability to treat people with compassion.
Yeah. And I haven't exactly endeared a lot of pharmacists to me.
Yeah, how have you been treated, Steve?
Well, I'm retired now, so I'm in a position where, I'm licensed in 2 states. What are they going to do? Revoke or suspend the license of retired pharmacists?
Right.
How's that going to work?
True.
So, but I said there's a lot of pharmacists who I pissed them off, and they call me names, and I tell them to go stick it up their lower posterior orifice, and I go on. But I know what Mark is doing, or is receiving, let's put it that way, from his supposedly colleagues. But I think the chain pharmacist in particular isn't far geographically removed from the physicians in the fear arena.
Yeah.
Yeah.
Hey, Steve,
I
was wondering, I got asked this a few times recently. Are you going to continue with your blog, or are you going to stop writing it? It's going around that you're not going to be doing it coming up.
I have put it on a hiatus right now.
Mm-hmm.
I'm not going to take it down. It's going to stay up. I'm contemplating starting a fee for service consultation. Haven't quite made up my mind yet. It's somebody said one time that a person who gets free advice often consider it not worth much. Consult with somebody from out of town, tell you what you already know, and charge them more than it's worth. It's in hiatus right now.
Okay.
I posted one thing I wanted to ask you. Could you send me the links to when you get these posted up on archives, and then I can go back and post the link on where I posted that the show's going to be?
Sure.
So that I can have it, so I can. The posting doesn't actually go dead. You'll still have a live link to the thing.
Yeah, absolutely.
I didn't want to take up Mark's time here, but
we have a question actually on YouTube for you, Steve. Jess from YouTube wants to know: do pharmacies or pharmacists sell herbal remedies? Do you know?
A lot of places stock herbal remedies. We don't get much. We get less education in herbals than doctors get in pain management.
Wow, that's negative.
Well, when I went to school, herbals was not even a discussion point. I mean, so it's whatever. Again, all healthcare professionals tend to settle into a subspecialty of some sort. Mine happens to be pain. I do a little bit with diabetes. I do a little bit with warfarin. But, I've got a friend who's got MS, then he starts talking about this. He's a pharmacist. And I'm going, go away. I don't even want to know about that stuff. It's out of, and getting HIV, that stuff goes right on my head. But I think Mark will agree that health professionals tend to settle in a subspecialty that they're familiar with and comfortable with. Wouldn't you, Mark?
Yeah, definitely.
Yeah.
Better for me.
Of course, ER doctors have to know everything.
Right.
Well, the first 60 minutes of everything, anyway.
Exactly. I've been hearing, I've been hearing, and a few people have asked too. I started to hear that pharmacists are going to be able to prescribe prescriptions for, like antibiotics and stuff like that. Not serious issues. Anybody hear that?
The PharmDs they're considered. Pharmacists in general and PharmDs in particular are considered mid-level practitioners. Mid-level practitioners fall into ARNPs, PAs, NPs. They're assistants to the prescribers, the doctors. California has passed a law on birth control pills. I think Connecticut has. Most states are now letting them prescribe or dispense Narcan without a prescription. They're doing all kind of vaccines from protocol. It's expanding. Where it's going to, how fast it's going to expand, where it's going to stop. There's been some talk about pharmacists doing strep tests in stores. Mm-hmm. So if they're doing strep tests, they might as well be prescribing the antibiotic for it. Some do blood glucose and A1Cs and INRs and that kind of stuff. Pharmacists are generally in a clinical setting are managing warfarin clinics. INRs and taking care of patients. You get into some of the VA and the Indian Health Services, they're almost they're given the latitude of an ARMP or a PA or MP. They prescribe and diagnose and on minor stuff, or the doctor diagnoses and they hand it over to the mid-level practitioner to manage and prescribe. So it's where we're going. How fast, where it's at, and every state's different. So, but I'm not going away. I just might be going a little quiet for a while with the blog.
Okay. Well, I appreciate you.
I'm not giving up with the question.
I hope it was okay that I asked.
Well, I know I owe you, Steve.
No, I'm not giving up with the Crown Pay community. I'm waiting for some law firms to get a whiff of this. And that's where I think the action is, and the results will be. There's just too much lip service and too much infighting, and too much discussion, and not enough action.
Mm-hmm.
Got it.
I'm going to take a call, Steve, if you don't mind staying on with us.
Okay.
Caller from area code 980. I believe it's Jess.
Oh yeah, absolutely.
Hey.
Hey, so hey, pharmacist Steve. So I follow you, but the reason why I asked that question is my pharmacist is an independent pharmacist, and honestly, I've been with him for years, and he actually offered to make me to give me some dried valerian root. I had inquired about it one time because, for one reason, we're looking at anti-inflammatories and things like that for the simple reason that I have severe gastrointestinal issues along with EDS and neuropathy and all that mess. So he was trying to find another way to help me manage the anti-inflammatory issues because, for example, I've been, sitting down and right now I don't even have an ankle anymore. I don't know what happened to it. It left. But he had offered to go ahead and, he stated that he was going to be selling, certain herbs, dried herbs. So I didn't know if any other private pharmacies did that. I'd seen it twice on YouTube, and I thought that was it because you are now seeing valerian roots, many popular herbs that are used exactly just for muscle spasms or yarrow. You're seeing those on the shelves at Walgreens and CVS. So that's why I asked. And he's made me creams before too.
Well, the chains will have stuff on their shelves because they can make money.
Mm-hmm.
That doesn't necessarily mean their pharmacists are knowledgeable. Sometimes that when I run into patients that the doctor's telling them, well, you either have your opiate or your benzo, and I go, well, there's always kava and valerian, and you can always deal with Benadryl, and you can kind of cocktail it to maybe get some good, but sometimes doing something is better than doing nothing. Particularly when you talked about anxiety.
Yeah,
anxiety and that kind of stuff.
My friend in Indiana, her doctor sells CBD oil.
The independent, I was an independent for 20 years. I had my own store, and the independent that I used the last time I was in there about a month ago, they had a big display sitting on the rack of CBD oil. It's legal in Indiana now. There was some discussion.
Well, isn't it legal everywhere? It's just without THC? Or no?
Well, it's according to state law. I just read something today that Ohio, they can't sell it in Ohio unless it's through a licensed marijuana dispensary.
Really?
The bureaucrats in every state are making up their own rules as they go along. Mm-hmm. As I said, but I saw the CBD in the independent and was talking to the pharmacist about it. I haven't went down that path yet.
Dr. Ibsen, are you going to?
Although,
are you going to go down that? Do you know?
Well, CBD is legal in Montana as long as it's less than 3% cannabis, 0.3% cannabis.
Okay.
Interestingly, there's a story.
Yeah.
THC, yeah. So in Wyoming recently, a woman was arrested because of the sheriff in that county saying if it has any THC at all, it's illegal. Of course, the Hemp Farm Act of, I think, 2016 indicated that anything below 0.3% is legal to be grown. So there's some overeager law enforcement people who are taking out people who have CBD products on their shelves. So who knows where that'll go.
Okay.
It's Wild Wild West, basically.
Yeah.
Well, thank you guys. Thank you, Pharmacist Steve. Did you have anything else that you wanted to add right now, or?
No, I just saw Mark was on there, and I said we don't get to talk much. We exchange a lot of emails, but we don't get to talk much.
Okay.
Thank you.
And we should change that, Mark.
Yeah.
Anyway, and I hate to take up your time on your show, and I didn't even butt in, but I tend to do that.
It's a great contribution. Thank you.
Thank you.
Okay. Take care of you, both of you.
Oh, sorry, we cut him off. Dr. Ibsen, so when you take a patient and you're weaning them off of pain medication, have you done that with all of your patients that were seeing you at one point?
Yeah.
Okay.
Except for the ones that couldn't.
Okay. The ones that couldn't, did you give it to them, or did you have to send them to somebody else and find somebody else that would?
I have patients that are no longer on opiates, and they still need to be on them, but I'm not prescribing them.
Okay.
And what I concluded is I can't help anybody from prison, and they'll send me to prison if I do it.
Right.
So that's the tragedy, and that is so painful for me to even talk about. I'll go to my therapist tomorrow.
Yeah.
But most patients, here's what I found out. Patients who are either sick of the BS around opiates or sick of begging their doctor or sick of the side effects of opiates, which include being more active and being able to get out of bed. But some people decide that they've had enough.
Yeah.
And when a patient wants to get off their opiates and they really want to, cannabis really works well. For people who've had their opiates taken from them and they're unhappy about it and they know that they're going to be suffering terribly, sometimes cannabis doesn't help them.
Yeah.
and that's all about what we're powerless over and what we have power over. And that is not to say that it's mind over matter. It's basically some people who've been forced to wean don't. It's a horrible thing,
Right.
and they end up going to bed, and like I said, 6 of my patients are dead.
I'm so sorry. I know. How do you wean? I mean, how do you do it safely? And what time period is that?
Well, it's here's what I tell my patients. If you ask your doctor to help you wean off your opiates, you will wean on your doctor's schedule. So, and this is strictly talking to people that are seeing me for cannabis recommendation for the first time and say they're still on some pain medication. What I recommend that the patient do is that they start stashing their medication. Anything you manage by scarcity is going to cause hoarding. I mean, hurricanes have taught us that with grocery stores. If people are undertreated in their pain, they're not going to have any stash. But if they're treated adequately in their pain and they get their cannabis card and they can find something that can substitute for it, then they can begin to bank away some of their opiates. And I tell them, once you have a couple of months banked away and you have confidence that your cannabis is going to do it for you, then you can go to your doctor and say, I don't need this prescription anymore. That's the best way to wean. I'm being vague deliberately because I think different folks have been able to wean, and many patients, at least 20% of my patients, have been unable to come off their medications. And when I was in practice and actively trying to help people who'd been abandoned by other doctors, I had many patients who I would wean them down to a certain level, and they couldn't go any further. I just remember this one patient. She came back to see me, and I dropped her dose, and she looked like a husk of a human being. I mean, she was dying before my eyes, and I could not. I just couldn't continue her weaning process. I had to take her back up to an appropriate dose, and that's what you do when you're a doctor. You try stuff, and then if it's failing, you abandon that theory and you go back to what's going to keep your patient alive.
Yeah.
So I am absolutely certain that some people's lives are saved by being on their opiates, and that and those are the people like the caller from the first half of the show. Those are the people I worry about the most because there's just nothing left for them.
Right. Does it change the process depending on how long you've been on pain medication? If you are weaning?
No, I don't think so. I think, well, I mean, once you've become dependent, which is probably within 3 to 6 months of starting on a regular opiate regimen, and people, some people don't withdraw at all if they just stop. Those are usually ultra rapid metabolizers, and so those opiates, are only lasting 2 hours instead of 6, so they never even get dependent. But in general, if somebody's been on opiates 5 years or 10 years, it takes them just the same amount of time to come off. And that's crazy because if they've been on opiates 5 years or 10 years, you know that A, it hasn't killed them, B, they haven't quit because of side effects, and C, it must be helping them. So why are we tapering them in the first place?
Right. Does cannabis actually, does it replace opiates, or is it, I mean, how are your patients on it, and how are they dealing with their pain right now?
Yeah, well, in Montana, it has to replace opiates because
right.
Because opiates are just almost completely gone. But are they getting good pain relief? I mean, some people tell me, neuropathic pain, it's amazing for that. Migraines, tremendous. Rheumatoid arthritis, 50% of my rheumatoid arthritis patients are on nothing but cannabis, including all the biologics. So cannabis has some profound effects on the immune system and on general well-being and the PTSD of having pain. But then again, there's some people that are, they've had 10 back surgeries and they clearly need more than just cannabis, and cannabis is all they can get.
Right.
But if it's all they can get, then they can at least get some sleep. then they can find a strain that can help them with some of their pain and take them from a 9 to a 7 instead of a being at a 3 if they were on their oxycodone, which they should be on.
Right.
But that's what we do. That's what we do now. You're going to have your 10th surgery, and it fails, and you go back to your surgeon, and he says, "Well, I'm sorry, I can't help you anymore." Yeah. What kind of healer is that? What kind of system do we have where we've gotten people and we've given them hope and say, "Oh, I'm going to help you. Your last surgeon didn't help you, but I'm going to help you." Or the last person who did your injection put it in the wrong spot. I'm going to put it in the right spot for you. And all these promises we make to people, and then it doesn't work out. And then all of a sudden, I can't see you anymore.
Right.
Or you looked askance at one of the receptionists, so we're not comfortable with you being here anymore. Or the quid pro quo that was quoted earlier. If you don't get your injection, we're not giving you the pain medicine. Well, that's just cruel. And it's the cruelty that's just killing me.
Question on YouTube. Dr. Ibsen, do you have any, I'm going to wreck the spell or the pronunciation, ankylosing spondylitis patients doing well on cannabis? Do you know what I'm saying?
I do.
Okay, good.
Yes, ankylosing spondylitis is an autoimmune spinal illness that causes the spine to fuse sort of like a bamboo. Mm-hmm. It's associated with a antigen called HLA-B27. It is a testable thing, and as autoimmune illnesses go, it doesn't destroy a whole lot of organs except for this fusion that the spine has. Mm-hmm. So yes, I have plenty of cannabis patients that are plenty of ankylosing spondylitis patients who qualify for cannabis. They're taking just cannabis, nothing else. It helps them move. It helps them with that spinal stiffness. And again, it helps them sleep because having your spine hurts really interferes with sleep.
Okay. Another question, does cannabis shrink tumors?
Well, you'd have some problems with the FDA if you made that claim, but I believe it does. But that's at the level of belief and not proof. I think that I've seen a few studies about in petri dishes, cannabis was toxic to cancer cells discovered in 1974. I have no doubt that my patients who report to me cures from cannabis, they believe it cured their cures from cancer. They believe that it cured them, and who am I to argue with that?
I've also heard about with cancer curing it, vitamin C powder without the additives. Have you ever heard anything about that or no?
No, I haven't.
So now that you kind of do alternative treatments and therapies or anything else other than pain medication, why do you think that they didn't set up something for people to go to or a better, program or structure instead of just, kind of taking everybody off of this and going after doctors?
Well, it wasn't well thought out, was it?
No. Why did they do that?
Neither was the Vietnam War.
True. But they're seeing people.
You're talking about.
Go ahead.
If you really approach this from a public health standpoint, I mean, when Dr. Lee in Washington was shut down, he was responsible for something like 25,000 pain patients, or the pain clinics in Indiana that had a similar situation. I mean, it was a public health crisis, and none of the legal people, the law enforcement people who wanted to impact addiction rates, and they were thinking or assuming it was because of doctors prescribing, obviously doctors prescribing increased and addiction rates increased, and everybody thought it must be causative. Well, the other thing that's increased that we haven't talked about is the poppy production in Afghanistan that's guarded by our troops. So, I mean, if someone had an overall look at that and said, well, gee, what's going to be the impact of all these people losing their opiates? Well, the law enforcement people think that they're selling all these pills, and they're not even considering the people are going to go through withdrawal because they don't think they're even taking them. So it never occurred to them that all these people would be actually needing these medicines. In their minds, it's dirty doctors and dirty patients, and they're all criminals, and they all deserve to suffer.
Yeah.
And they never thought about the consequences of having people kill themselves, or the consequences of driving people to a black market, which is where things aren't regulated. I mean, pain pills on the street these days are all counterfeit. They're contaminated with heroin. That's how Prince died. So if you they don't care about that. They care about their numbers and their it's just thrilling to a county attorney to take down some doctor who must be a bad doctor and therefore build up his career and run for governor someday because he took out this bad doctor, even though he took out 800 pain patients with him.
Yeah. Is your reputation ruined, would you say, now because they went after you? No, I don't think it's ruined. I mean, I think I was talking to my son about this the other day. He was just about to go back to college. He's a junior, and guess what? He's pre-med. I can't believe it. And he said to me, Dad, things have shifted in the community about you. And I said, oh, really? What? And he said, well, people who don't know you, they were judging you, and they saw a headline that you've been exonerated, and it's shifted people's attitudes. And then I said, well, what about the people who knew me? And he said, well, they always knew you were great. Yeah.
That's all that matters to me is what do my kids think of me? I don't care what somebody else who doesn't know me thinks. I paid a price for this, but I got to tell you, I would not have done it any differently. I did what my Hippocratic Oath told me to do.
Mm-hmm.
And I couldn't live with myself if I didn't.
Well, you've done a very commendable and brave thing because there's just so few doctors out there that are willing to do what you've done. So thank you. And I know a lot of other people appreciate you as well. We all see it. So you're so rare.
Thank you very much. Thank you. We just have to keep laughing.
Yeah.
And not let the mother truckers get us down.
Yeah. Well, Dr. Isben, we're going to wrap up here. Did you have any last words before we get going here?
No.
It
sounds like a guy at a firing squad.
Yeah.
I'm going to say my last word.
Well, yeah, you're right. And I say that all the time too. I should probably change that, huh? Well, thank you so much for coming on.
I just want to keep helping people if I can. If I can help people, I'll keep trying. That's what I'm designed to do.
Well, I appreciate you coming on this evening and sharing what you've gone through, and also all the wonderful advocacy work you're doing, and for standing up for doctors and patients. Thank you.
Yeah, it's my pleasure.
Okay.
Thanks for what you're doing, and thanks again to Pharmacist Steve. He's got to send me a bill because I owe him something. He saved my butt several times. So.
Well, he said this time, and actually when you were on in May too, I think he called in and he said we have to start talking more. So you guys need to talk more.
Okay.
All right. Have a good night.
All right. Take care. Thank you.
Mm-hmm.
Bye-bye.
Bye. All right, don't forget to join us next Tuesday with Dr. Klein at the Doctor's Corner, and Coronation will be on next Wednesday as well. And thank you for taking some time out of your evening to join us here at Coronation. I'm Janelle Elgoy signing off until next Tuesday. Have a great night.
Listening to Conspiracies Against Wellness with your host, Janelle Elgoy. The opinions expressed on this program are those of the host and callers, and not necessarily those of EXG LLC, its employees, or sponsors. Copyright 2018 by EXG LLC. All rights reserved.